Welcome back to Clinic Annex. After that video on causes and prevention of cancer, some people have asked, what are the symptoms of cancer? Yes, I have told you that cancer is a broad topic, but what we are going to do is discuss it in bits until we have exhausted everything you need to know about cancer. So today we will devote the time to talking about the symptoms of cancer. Cancer is no respecter of anybody or any body organ. So it can affect any part of the body, from the skin to blood to bones. So any part of the body can be affected, and the symptoms will depend on what part of the body is affected. Now, what are those symptoms? Let's start with fever. A person might have high temperature, persistent high temperature. Childhood cancer can come with fever. You may not see any other symptom other than fever. And fever means that the body is hot. So you might have excluded all forms of infection, no parasitic infection like malaria, no bacterial infection, no viral infection. Why is this child always hot? That may be as a result of cancer. And it can be missed because people don't expect children to have cancer. So nobody is even thinking about cancer. Please, if you have a child who is always having fever, think cancer in such a child. Number 2 is change in the texture or color of skin. Yes, maybe you don't have a birthmark in a part of your body, but suddenly something that appears like a birthmark appears, or a mole, or you had one that is now changing. It is now getting thicker and wider, or it's now beginning to itch or bleed. Think cancer. It may be a cancer. Another one is ulcer that is not healing in any part of the body. This person is not a diabetic patient, and yet they have an ulcer that is not healing. You should think seriously about cancer, because if you have a wound, it should heal in days or weeks. Another symptom is lumps in the body. Lump anywhere in the body should be reported. It can be in the breast, it can be in the armpit, or in the groin. If you find a lump in your groin and you don't have infection or wound in your leg, it can be as a result of blood cancer. So that will be a lymph node that is eroding a cancer somewhere. So please, if you find lump in your armpit, in your breast, that may be breast cancer. The nipples may be inverted, it has gone inside, or the nipples are discharging, bloody discharge especially, or there is dimpling of the skin of the breast, or there is swelling of a part of the breast, or there is change in the size and symmetry of the breast. This can also be a sign of breast cancer. So any deviation from normal that you see in the skin of any part of the body or in any organ of the body should also be reported. Another one is abnormal bleeding from the bladder, rectum, or vagina. Let's start with the bladder. If a person begins to see blood in their urine, then they may have cancer of the kidneys or the ureters or the bladder, or for men, it can be for prostate. Now let's go to bleeding from the rectum. That can be as a result of colon cancer. You know that people who bleed from the rectum might have hemorrhoids. But if this hemorrhoid is coming for the first time at age 40 or 50, then it may not be hemorrhoids. It may actually be cancer of the colon. It can also be abnormal bleeding from the vagina, intermenstrual bleeding. It can be spotting or heavy bleeding in between two menses. Intermenstrual bleeding can suggest cancer, cancer of the cervix or endometrium, or a woman that no longer menstruates, a menopausal woman who begins to bleed spontaneously. It is not your period that returned. It might be cancer, cancer of the cervix or of the endometrium. Or there is contact bleeding, bleeding during sex or after sex. That also is not normal. Or bleeding to examination. A doctor has just examined you, and then they withdraw the hand, and then the glove is stained with blood. It can be cancer of the cervix. Or the person begins to have abnormal discharge. A woman can normally have discharge during the cycle, during the month, but this time around, a different discharge, offensive, watery, or bloody. You can also think about cervical cancer. Now let's talk about changes in bowel habit and bladder habit. If a person who normally wakes up in the morning, and this affects both men and women, normally wakes up in the morning and defecates, now they are not able to defecate for days and weeks, sometimes up to 2 weeks, no defecation. And now they are beginning to abuse laxatives so that they can move their bowel. That can be as a result of colon cancer. Yes. And this person may also have diarrhea. The person begins to have diarrhea alternating with constipation. So don't think that it's just diarrhea or it is just constipation. You are using laxatives and you are using ORS. No, please see a doctor. What about change in bladder habit? If you have change in bladder habit, you are now not able to urinate freely. You are having urgency. Before you get to where you are going to urinate, you are leaking urine. Or you are waking up frequently to urinate at night and you are an older person, 50, 60, 70. Yes, we might be dealing with a prostate problem. And prostate problem can be either harmless enlargement or prostate cancer. So if there is a change in the way you urinate, please see a doctor. It might be prostate cancer. Another one is persistent cough or hoarseness. Hoarseness of the voice. Of course, it can happen if somebody is yelling, they are singing, but if it persists and it is not going, you have rested the voice, it is not going, then it will be cancer of the larynx, the voice box. So they should see a doctor. Or cough that has been persistent. It could be dry cough or productive or bloody, cough productive of bloody sputum. Whichever it is, if you have treated pneumonia, some people will say they have pneumonia recurrently. If you have treated pneumonia for a while, you have excluded other pathologies, then please think cancer of the lungs. Another symptom is unintended weight loss. Somebody is just losing weight. They don't have HIV, they don't have diabetes, but they are losing weight and they are eating, they are trying to eat well. They are not doing it intentionally. They don't want to lose weight. That can be cancer. Unfortunately, it can be a sign of advanced cancer. And it occurs across all cancers. After some time, the person begins to lose weight because the cancer now gets to spread to other parts of the body. So weight loss, unintended weight loss, is something to watch out for. And another one is fatigue, because many times when the cancer spreads, it can spread to the bone marrow and it suppresses the production of blood. So they ultimately have shortage of blood and they begin to feel weak and tired and fatigued. And sometimes they are not able to eat. They have nausea, loss of appetite, sometimes they vomit, and that can make them to also get fatigued in addition to the anemia. Bone pain is another. By the time a person begins to have bone pain, it could be that they have primary bone cancer, cancer that originates in that bone. It could come with pain. But sometimes it is cancer that is coming from spread from another source. Breast cancer and prostate cancer usually spread to the bones. So they may have pain in the bones as a result of this other cancer. But by the time a person begins to have bone pain, weight loss, fatigue, nausea, vomiting, that may be a sign of advanced cancer. So what we actually want to watch out for are the early signs, early symptoms of cancer, such that that person can target survival during treatment. The treatment will be so that this person can survive, not palliative treatment, just to improve the quality of life, for the remaining period of that person's life. But I would like to say finally that these symptoms can also happen in other conditions. And that is why doctors have differential diagnosis. So we say, okay, these symptoms, can they be symptoms of cancer or symptom of an infection? So if you have any of these symptoms, don't conclude that you have cancer, because they may be symptoms of other conditions. But please see a doctor whose responsibility it is to distinguish between these conditions and say, oh, these symptoms are those of cancer and not those of other conditions. I hope it's helped. Please share with everybody you know, your friends, your family members. And thanks for watching. Always remember, good health is great wealth. One of the things that can help us to achieve good health is focusing on prevention. Prevention at all levels, primary, secondary, and tertiary levels. I'll see you again with another topic next week, God willing. Until then, please take care of yourself. Bye for now.